we have some very good questions that are coming in. I'd like to address a few of them. For starters, I like the concept behind this question because it's something that we've actually embraced. Who's going to teach this to minority business enterprises? Part of the mechanism that we have put in place as part of the Simcoe solution is that we're going to take you where you are. Part of our goal is to not only work with established entities like innovative risk reduction advisors, who are super subs, as we call them, and with all due respect, could and should be primes themselves, but entities that are smaller, younger in the game, or who aspire to become a certain stage of business. So inside of the Simcoe solution, there's going to be a lot of mentoring, a lot of conversations about opportunities, a lot of working with other businesses that are more experienced with you. And part of their agreement very well may be to work with smaller contractors so that we grow the capability and the talent pool of diverse businesses across the entire state. That's something that's very important to us. Along those same lines, part of the conversations that we're going to be having piggyback on a consideration that the senator just mentioned. We literally want to have specific, detailed conversations about opportunities that are based on the Illinois Legislative Black Caucus healthcare pillar that just passed. You know, there's a lot that was in that, and we are the entity, literally the chamber I'm speaking of specifically, but Simcoe, as what will become the leading voice of healthcare in the state in terms of a corporation, we actually will be looking to ensure that participants in the Simcoe solution are aware of those opportunities wherever they are, whether it's the healthcare pillar within the state or whether it's the American Rescue Plan from the federal standpoint. So being a part of the Simcoe solution really means that we're going to be that think tank that works with you, mentor you, help you grow, and launches off additional businesses in different directions based on opportunities. So thank you for that question. Here's another one. How could you bring preventive care to our area? We didn't get into much detail about the logistics of how the Simcoe solution will work, but it was mentioned in passing. We actually envision having as many as a dozen different health hubs in different parts of the state. So these are going to be physical entities that are literally health and human service centers where there will be dozens of hours a day of health education and personal training and cooking classes and education for those that might need a GED, smoking cessation considerations, all the things that comprise implementation of best practices and reduction of those negative social determinants of health. So we'll be there. And in between the areas in which we don't have health hubs, we literally are envisioning, you guys may remember when some of us were younger, where library vans would traverse the state providing information. It is our goal to have mobile units all across the state visiting communities on a daily basis, providing this information and engaging in health prevention and health promotion wherever the need exists. We're going to be very active participants in this. You know, I'm an emergency physician by training, and I promise you, this is not going to be a situation where you have one visit a year and you're left to your own devices the other 364 days out of the year. We want to be your personal health consultants, and we want to engage you in your health journey again and again.
And I'd just like to add that part of our strategy includes, you know, what I mentioned before, community health workers, you know, is one that we plan on using to help with getting to patients. You know, I mentioned, like Dr. Sterling just said, seeing people outside of a doctor's office, emergency room, a hospital bed, getting to where they are, helping improve their social determinants of health so that they lead healthier lives.
Absolutely.
Reverend Johnson, so there were a couple of comments about how specific vendors can do specific things. I'd like to refer you to our website and just make an appointment to talk with us one-on-one, talking about how your particular expertise can be integrated into the Simcoe solution. We really want to embrace the entirety of health that is based in health prevention and health promotion. And if you are a holistic, if you are a personal trainer or a yoga instructor, we want to have all of those conversations. So please join us. I want to thank all of you for time, attention, and engagement. I appreciate the level of participation that we've had. And I just want to open up finally to the various members of the panel to see if you have any final questions or comments. And I'm not going to pick on you individually because you may not have anything to say, but
Dr. Sterling.
Please feel free to do so.
Yeah.
Was that you, Larry?
Yes, it was. I just wanted to ask this. I've been trying to hold back, but I just want to ask this question of you and of the panel and Senator Clay and Senator Kaler. You know, with sick care being what we do instead of preventive care, when this makes so much sense, what's our biggest hangup of getting this across the finish line and putting something in place so you can at least do a comparative analysis in terms of the real impact it has in terms of driving the cost of healthcare down, and then also having a successful outcome? What's the biggest barrier? Is it a lack of political understanding? Is it a lack of big insurance companies not wanting it to happen? I mean, what's the biggest barrier? Because this seems to make so much sense to me. I'm trying to figure out when something makes this much sense, there has to be some rationale, at least whether it's real or not, some rationale as to why people aren't moving forward when this makes so much sense when we listen carefully to everything that you guys just expressed.
Well, Larry, I want to be very careful in my comments and very respectful in my comments, but in general, we fear the unknown, what we don't understand. And if you're receiving $19 billion a year to produce the type of outcomes that are being produced without accountability, you can get very comfortable with that paradigm. I think that in the conversations that I've had, and I've been invited to many different panels by state level committees to discuss healthcare in general and healthcare in the state of Illinois, there actually is a desire to do better. And I say that with complete certainty. It is so rare, insightful, and true to have someone actually say that money isn't the problem in the state of Illinois. Senator Kaler said that, and I promise you, there are countries that aren't spending $19 billion a year on healthcare and producing better healthcare outcomes than the state of Illinois. True story, we work with them. And there are just, people do what they're incentivized to do. And in this conversation, people are comfortable with the paradigm. And until enough is challenged, or until a better mousetrap is built and the right type of consensus grows around it, which is exactly what we're trying to do here, you really can't expect people to do differently. Just to give you one example, I mentioned, it's been talked about quite a bit in this panel, how little money is actually being spent on diversity communities, diversity businesses as part of the BEP program. But yet and still, every year people celebrate the year-over-year increase when on a absolute numbers are still abysmal. And if that's the level of accomplishment that is met with applause and success, it's a mighty mountain to climb in order to have an objective conversation that isn't called radical or complaining, and at the risk of being blackballed, no pun intended here, just bringing attention to best practices is something that has been met with head scratching. I mean, as soon as we have these conversations, which are universally applied and known, the most common question we get asked is, well, where else are they doing this at? Well, you can pretty much look at any country in the world that is engaged in health prevention and promotion and answer that question. So this has been a difficult and incredibly, quite frankly, an incredibly difficult business environment because you have an entrenched power structure. But to be fair, our General Assembly members, as evidenced by senators' presence in this forum, they want to do the right thing, and it just takes subject matter expertise to make the case, present the case, and for there to be a sufficient groundswell of support from the business community to get it done. And I dare say, I think that we're very close to doing better for the citizens of the state. If anyone else wants to jump in on that conversation, please do so. And Larry, if that answered your question, great. If not, you can feel free to follow up.
That was very well put, Dr. Sterling. Yeah, you were very polite and very careful in your words. This is a turf issue, quite frankly. There are recipients of that $19 billion, and they're very happy with that way. We as legislators have to really be concerned about what is good for the citizens of Illinois, and that's where our focus has to be. And this is a strategy that makes sense for the citizens of Illinois.
Any other final comments from the panel? If not,
Hey, Jeff, there was a comment about cybersecurity, and
yes.
I just wanted to make a quick comment about that in terms of what Simcoe will be doing as relates to cybersecurity. And we understand that, you know, the security risk and the fact that it's virtually impossible to eliminate completely, you know, the vulnerabilities that are going to be exercised by bad performers. But we're going to implement, you know, the best practices within our operations. We will also teach our vendors and have processes that they need to also adhere to in order to access our network. We'll have our employees, who is just probably, and our staff, who is probably the most you know, critical link in the chain in terms of providing you know, access to, you know, issues. We'll train our employees continuously on cybersecurity and responsible computer use, and et cetera, et cetera. And for those things that we can't manage, we'll use Brian to transfer that risk. So we'll cover it everywhere. So.
Well, thank you. We like to begin on time and end on time and respect people's time. So with that, I will end the conversation. Again, thanking our panelists, our participants, the Illinois State Black Chamber of Commerce for the leadership in providing this forum. And I hope to talk to many of you in a way that furthers healthcare for the citizens of the state. And with that, we will bid you good afternoon.